President Akufo-Addo, if I can greet you specially as an in-law, Akwaba. And now, can I ask you 4 simple questions? President Akufo-Addo, what did you see before you? What did you do about it? Why did you do what you did? And how is it going?
First of all, I'm very happy to be part of this event, and I want to thank you, Hakeem, Belo-Osagie, for the opportunity to be part of it. I think right from the beginning, when the pandemic broke across the world, and particularly, of course, in our country, it appeared to be clearly much more than just a public health threat. Its socioeconomic implications were evident, at least from the way we saw it here in Ghana, from the very word go. So the most important decision that was taken right at the beginning was to look at this matter as an all-Ghanaian matter, whereby all the stakeholders, whether religious, political, civil society, business, traditional leaders, would all have to come together with government, because it was not going to be possible for government on its own to resolve the issues involved, to come together on a consultative basis to find a way forward. So that is the first thing that I saw. And then beyond that came the need, first of all, to establish a legal framework for dealing with the matter, because our own laws were relatively inadequate, and therefore we had to work with Parliament to establish a legal framework for doing this, which essentially has been the establishment of emergency powers under the Imposition of Restrictions Act, and then move from there to the institutional vehicle. I thought that right from the beginning it was necessary to pool the resources of government as well as of the experts we have in our country, both scientists, economists, public health, and medical officials, to put them all together in the task force, which is headed by a very distinguished public health official, a former Deputy Director General of the WHO organization, to be the spearhead for confronting this. So that is those are the things that I saw. The doing was, after assembling the institutional and legal basis for action, was to look at how quickly we can mobilize our system to do the key things, which continue to be at the heart of our strategy: tracing, testing, and treating. That is what has brought us where we are, whereby we've been able to identify considerable, but in relative terms, the population of people who are infected, who have now been put in isolation and treatment centers, and whose contacts are the object of the enhanced tracing that we're going through here in Ghana. It's been a difficult exercise because this is proving to be an extremely expensive enterprise, not budgeted for, but having to find the resources to meet not just the public health hazard, but also the socio and economic implications of it. We know, for instance, that the economies of our country, and Ghana is no different from most of the economies of Africa, are heavily dominated by informal enterprises and informal workers, who are essentially daily rated workers, if you like, in conventional Western terms. They're people who have to go out on a daily basis to look for their wherewithal to keep their families going. And they are the dominant element in the labor force, the dominant element in the economic structure of our country. So whatever design, whatever policy that had to come out of it, had to take them very much into consideration. It meant also that we had to identify very quickly one or two key factors. One, the recognition that the initial importation of the virus into Ghana was essentially foreign-led. Travelers, both Ghanaians and foreigners who came into Ghana, who brought the virus into the country. And therefore, quarantining, if you like, the country from the importation of the virus became priority number one. We moved very quickly from measures to dealing with travelers coming from the then epicenters of Asia and Europe to a blanket quarantine of the country, which required that, especially at the moment when we were imposing the measures, that everybody who came into Ghana at that moment had to be mandatorily quarantined and tested. It turned out to be a very felicitous decision on our part, because the weekend when the measures were put in, which was over a month ago, that very weekend, over 1,000 people came into Ghana who were mandatorily quarantined and tested. 10% of them turned out to be positive. And you can imagine the implications for the country if that 10% had been allowed to get into the population. So we were able to isolate them, treat them, and the overwhelming majority of them are now back with their families because they've then tested positive. So the identifying where the key elements were in the spread of the virus was very important. Then the measures that were put in to try and contain, slow the spread are the ones that I've already alluded to. We then also took the very important decision that we had to find some way to limit the impact on the most vulnerable sectors of our society. Once again, difficult decision to implement because of, one, financial constraints, and secondly, institutional weapons that were available for being able to reach out to these vulnerable communities. But we made a good fist of it. We worked, and it's been one of the key aspects of our approaches that we have found that Parliament very receptive to working with the executive in trying to design policies that would enable us to look at this. So the passage of monies that were available to government were relatively agreed and acted upon by the Parliament as it. So we had also a period when we found it necessary to isolate the two main centers of the virus in Ghana, which is the capital, Accra, for obvious reasons. If the travelers were the people who brought it in, the capital would be the obvious place where it would then spread. So we had a period, nearly a month, 3 weeks, where Accra and then Kumasi, which is the second city of our country, were the areas which we, as it were, closed down for a period in order to see how the virus traveled in those two cities. And after 3 weeks, we were satisfied that we had a good understanding of the movement of the virus so that we could then remove the restrictions on movement in these two cities, but continue with the strategy of tracing, testing, and treating. So there's where we are. We've been able to test over 100,000. I think it's something like nearly 110,000 people. Altogether, the numbers of people who have been the object of the tracing is somewhere around 120,000. So I think that by the end of today, that will be the figure that would have actually been tested. And out of it, consistently through the period of the testing, we have seen that the positivity rate, that is the numbers of people who have turned out to be positive in the population sampled and tested, has remained very consistent and constant, around about 1.5% of the population. Fortunately for us, also the deaths have been relatively small, if not, if you like, insignificant. Not the deaths of anything are insignificant to those in fact, but within the larger context of Ghana, I think we've reached about 18 people so far. These are relatively small numbers, and virtually all of them information I have is that all of them are the result of some sort of comorbidity. There are underlying health issues with all those who've been identified as having died as a result of being affected also by the virus. So that's where we are. We have a number of somewhere like 1,671 who have been tested. The overwhelming majority of them, 1,400 plus, are in fact responding to treatment, doing well. They are moderate, in some cases, without any symptoms at all. And 6 in critical condition who are being looked at in the hospitals. Our main concern has been to see what we could do to prevent sickness. As you can imagine, the public health system of our country is relatively weak. I mean, in comparative terms in West Africa, it's touted as one of the best because we have quite a developed health insurance scheme. But when you look at the facilities and the spread of its infrastructure, a large number of sick people would pose a major challenge to the health system. So the emphasis has been to, as much as possible, go out there, look for those who may be infected and deal with them so that we don't translate them from being infected to becoming sick. And then, of course, those who are sick, who are dealing, also extract the population of those who are sick. It's been a very challenging exercise. We have said to ourselves that as much as possible, we should always look at the Ghanaian specific situation. Yes, we are all witnesses, the medium we're on now, and television and all of that makes it possible today to sit in Accra and see what's going on all over the world and look at the various examples. The methods that have been used in Europe, we've seen what has gone on in Spain, in Germany, in Italy, in England. We've seen also the American response as well as the original Chinese response. But we think that it's very, very important for us, and our scientists keep telling us that too, that we maintain an African and Ghanaian focus on how to go forward and try and contain this virus. In so doing too, of course, we can never forget the critical need of finding ways also to maintain the integrity and the viability of our economy. The Ghanaian economy was to collapse. It would only complicate our ability to find the resources to deal with the virus. So side by side, it's a balance that is being struck all over the world, the balance between livelihoods and lives. We have to continue to strive to maintain that balance. So I hope I have, in my own manner, been able to respond to all your questions.
Very much so, very comprehensively indeed. I just need to ask 1 or 2 questions to the President of Ghana before he leaves for an emergency meeting that he's having with his cabinet on this precise matter to do with Corona. Mr. President, you have lifted the lockdown in your country, and it's very fascinating to a lot of the people who are looking at events all over Africa. What are the preliminary results that you're seeing from your lifting up the lockdown? And are there any circumstances under which you may resume the lockdown?
Well, first of all, I think we should have a context. Measures against public gatherings, the closure of the schools, all those are still very much in place, as well as, of course, as I indicated when I first spoke, the closure of our borders. What took place in terms of our 2 cities, Accra and Kumasi, was within this larger framework of policy. And there, what we saw was that the information that came through told us quite a lot about the trajectory of the virus. Where it was, we've been able to identify the areas where it is. We're therefore in a better position to, if you like, identify its geographic footprint, and therefore intensify our tracing and testing machinery in the areas which have been identified. And it's also enabled us to be able to see what we needed to do to prevent it going elsewhere. It's been a difficult exercise, largely for many of the reasons that which the professor has also identified, the very different social and economic circumstances of our economies and societies here in West Africa, which makes communal living almost de rigueur. I mean, it's part and parcel of our structures. And therefore, the application of the social distancing rules become very much more problematic. We are now investing a lot of energies in seeing to it that people wear the mask. We see it as a very direct and manageable way of getting as many people as possible protected from the disease by the wearing of the mask. It's an easier solution than the strict enforcement of the social distancing. I'm not saying that they're irrelevant, but we have also to recognize the realities of the societies in which we're working, and then put the emphasis there. That's more. The decision as to when public gatherings can resume has not yet been taken. We are not still sufficiently confident that we have the grip on the virus that we want to have. The same way, of course, the closure of the borders is still not being removed. We think we need to maintain it. In fact, we're trying to strengthen our borders because we're having episodic efforts on the part of our neighbors or people coming in who subsequently test positive. So that's a measure that we're not about to undo any time from now. But the overall picture is that the rate of infection is something which is relatively constant. We're not seeing this large explosion that was feared for our country at the beginning, and therefore the ability to manage those who are identified as infected is much more within our means than initially we thought. Nevertheless, we're having to make significant preparations and significant investments in two things that is important. First of all, in our public health system. It's quite clear that we need to strengthen it significantly to be able to meet not this, but also future pandemics. And then secondly, our own domestic production of products to satisfy our needs. Ghana, like many of the economies of West Africa and Africa, are heavily import dependent on virtually all aspects of our national lives. It certainly is not conducive for our self-reliance, our capacity to do things for ourselves. So that is the other area in which a lot of emphasis is now being put. How, obviously we begin with the pharmaceutical industry, but beyond that, the productive aspects of our economy, how we can continue to strengthen that. So this will be my response to that. But I'm going to have to beg leave. Yes. Of this panel. I'm really unhappy that I'm not able to stay and participate in all of it. But perhaps you'll find an opportunity for me in another occasion to do it. But thank you very much for the opportunity to come.
And thank you very much, President Akufo-Addo. And we wish you all the best and wish your country all the best as it confronts these challenges. Thank you very much, President Akufo-Addo.
Thank you.